You've scheduled your surgery, now what? If you smoke or vape, you want to stop that immediately. You want to stop as soon as possible because you do not want to hinder the healing process.
We want you to work with your primary care physician to optimize any chronic conditions you might have, such as diabetes, hypertension, or thyroid conditions.
If you haven't had lab work within the last 3 months, we'll supply you with an order for some basic preoperative lab work to ensure your safety during your procedure.
And if you are on a GLP medication, we do ask that you stop it 1 month before your procedure so that you can ensure proper nourishment before your surgery.
Go ahead and gather your questions to bring to your pre-op appointment, which will be approximately 2 weeks before your procedure.
We'll see you there.